Part 3. Clinical significance of tongue diagnosis in warm diseases. 辨舌在温病学里面是非常重要的一部分。Tongue diagnosis is an extremely important aspect of warm disease theory. 通过观察舌苔、舌筋以舌形的变化，我们能够判断疾病的发展情况。By observing changes in tongue coating, tongue body, tongue fluids, and tongue shape, we can better understand the progression of disease. 一般来说，舌苔主要反映功能方面的问题。Generally speaking, tongue coating mainly reflects functional changes in the body, 而舌质则更多反映疾病的实质变化。Whereas the tongue body more often reflects underlying pathological changes. 舌筋则能够反映津液受损的程度。Tongue fluids reflect the condition of body fluids. 因此，通过辨舌，我们可以分析病邪的性质、病位的深浅、病势的进退，以及津液损伤的程度。Through tongue diagnosis, we can evaluate the nature of pathogenic factors, the depth of disease, disease progression, and the degree of fluid depletion. 第一，辨别病邪的性质。First, differentiating the nature of pathogenic factors. 由于四时温热邪气不同，因此舌象的变化也会有所不同。Because warm heat pathogens differ according to the seasons, tongue manifestations may also vary accordingly. 在临床上，我们经常通过观察舌苔来判断病邪的性质。Clinically, we often judge the nature of pathogens through observing the tongue coating. 比如，湿热之邪通常会出现黄滑腻的舌苔。For example, damp heat conditions often present with a yellow, greasy tongue coating. 如果舌苔颜色深黄，而且黏腻厚重，通常提示热重于湿。If the coating is deep yellow, thick, and sticky, it usually suggests heat predominating over dampness. 相反，如果黄色浅，舌苔虽腻但不厚重，则多提示湿重于热。On the other hand, if the yellow color is lighter and the greasy coating is not very thick, it usually suggests dampness predominating over heat. 第二，区分病位的浅深。Second, distinguishing the depth of disease. 温病的发展一般会经历微期、营血4个阶段。Warm diseases generally progress through the 4 stages of weeing and blood. 病邪会由表入里，由浅入深。Pathogens move from the exterior into the interior, and from superficial levels into deeper levels. 因此，我们可以通过舌象变化来判断病位的深浅以及病情的轻重。Through changes in the tongue, we can estimate the depth and severity of disease. 比如，舌苔薄白，往往提示病在肺位，病位较浅。For example, a thin white coating often suggests disease at the lung way level, which is still relatively superficial. 如果舌苔发黄，舌质发红，则说明病邪已经进入气分。If the coating becomes yellow and the tongue body turns red, it suggests the pathogen has entered the qi level. 而如果舌质线红洽，则提示热邪已经深入营血。When the tongue body becomes crimson red, it usually indicates that heat has penetrated into the yin and blood levels. 第三，分析病势的进退。Third, evaluating the progression and resolution of disease. 温病的发展变化，其实反映的是正邪双方力量变化。The development of warm diseases reflects the changing balance between healthy qi and pathogenic qi. 如果邪气盛，正气虚，病情就会加重。If pathogenic qi becomes excessive while healthy qi weakens, the disease tends to worsen. 如果邪气退去，正气恢复，病情就会逐渐好转。If pathogenic qi declines and healthy qi recovers, the condition gradually improves. 临床上，我们通过舌苔眼后walls以及舌质的变化来观察病势的发展。Clinically, we observe changes in coating color, coating thickness, and the tongue body to evaluate disease progression. 一般来说，舌苔由白转黄，提示病情在进展。Generally speaking, when the coating changes from white to yellow, it suggests the disease is progressing. 如果由黄转黑，则说明病情加严重。If yellow turns black, it usually indicates a more severe condition. 舌苔由薄变厚，提示邪气较盛。When the coating changes from thin to thick, it suggests pathogenic qi is becoming stronger. 而由厚转薄，则说明邪气开始减退。When thick coating gradually becomes thinner, it suggests pathogenic qi is declining. 第四，判断津液的存亡。Fourth, evaluating the preservation and depletion of body fluids. 在温病里面，津液存亡对疾病预后非常重要。In warm diseases, the condition of body fluids is extremely important for prognosis. 叶天士曾经强调，刻刻顾及津液。也将其 once emphasized, one must constantly protect body fluids. 因此，临床上常常通过舌诊来判断津液是否受损。Therefore, clinically we often use tongue diagnosis to evaluate whether body fluids have been damaged. 如果舌面润泽，说明津液尚未受伤。If the tongue surface appears moist, it suggests body fluids are still preserved. 如果舌面开始干燥，则提示津液已经开始受损。If the tongue becomes dry, it indicates body fluids have begun to decline. 如果出现裂纹、焦躁无津，则说明津液损伤更加严重。If cracks, scorched dryness, or absence of fluids appear, it indicates more severe fluid depletion. 第五，判断病情的虚实。Fifth, evaluating deficiency and excess patterns. 黄帝内经说，邪气盛则实，精气多则虚。The Yellow Emperor's inner canon states, when pathogenic qi is excessive, it is excess. When essential qi is depleted, it is deficiency. 因此，我们也可以通过舌象来判断病情属于虚症还是实症。Therefore, through tongue diagnosis, we may determine whether a condition is one of deficiency or excess. 一般来说，舌苔厚腻、舌尖鳞起刺多属于湿热之症。Generally speaking, thick, greasy coating, vivid coloration, and prickles on the tongue tip often indicate excess heat patterns. 而舌苔剥脱、无苔或者舌体娇嫩枯萎，则多属于 peeled coating, absence of coating, or a tender and withered tongue body more often indicate deficiency patterns. 总的来说，舌诊是温病辨证中非常重要的一部分。Overall, tongue diagnosis is a very important part of warm disease differentiation. 在临床上，我们需要仔细观察、全面分析。Clinically, we must observe carefully and analyze comprehensively. 这样才能让舌诊在温病诊断中发挥更大的作用。Only in this way can tongue diagnosis contribute more effectively to the diagnosis of warm diseases.